Hi, everyone, and welcome back to Health Made Simple. Today, we're diving into a topic that affects millions of people worldwide, atrial fibrillation, or AFib for short. Whether you've been diagnosed with it, know someone who has, or just want to learn more, this video will cover everything you need to know, what it is, its symptoms, how it's diagnosed, and how it's managed. Let's get started. Schedule. First, what exactly is atrial fibrillation? AFib is a type of irregular heartbeat or arrhythmia where the upper chambers of the heart, the atria, beat out of sync with the lower chambers, the ventricles. Instead of a steady, rhythmic beat, the heart quivers or fibrillates, which can lead to poor blood flow and increase the risk of complications like stroke or heart failure. Now, you might be wondering what causes AFib. Well, it can be triggered by several factors, including high blood pressure, heart disease, excessive alcohol consumption, thyroid problems, or even stress. Sometimes it can occur without any obvious cause, which is known as lone atrial fibrillation. Now, let us learn about this in detail. Atrial fibrillation, AFib, is a common type of cardiac arrhythmia characterized by an irregular and often rapid heartbeat. It occurs when the electrical signals in the heart become disorganized, causing the atria, the heart's upper chambers, to quiver or fibrillate instead of contracting normally. This disrupts the coordination between the atria and the ventricles, the heart's lower chambers, leading to an irregular and often inefficient pumping of blood. What happens in a normal heart? In a healthy heart, the electrical signals that control the heartbeat follow a precise pathway. The sinoatrial node, or SA node, often called the heart's natural pacemaker, generates electrical impulses. These impulses travel through the atria, causing them to contract and pump blood into the ventricles. The impulses then pass through the atrioventricular node, or AV node, which acts as a gatekeeper, slowing the signal slightly to allow the ventricles to fill with blood. Finally, the signal spreads through the ventricles, causing them to contract and pump blood to the lungs and the rest of the body. This process results in a regular, coordinated heartbeat, typically at a rate of 60 to 100 beats per minute at rest. What goes wrong in AFib? In AFib, the normal electrical activity of the atria is disrupted. Instead of a single, organized electrical signal originating from the SA node, multiple chaotic electrical impulses fire simultaneously from different areas of the atria. These disorganized signals cause the atria to quiver or fibrillate, rather than contracting effectively. Here's a step-by-step breakdown of the pathophysiology. 1. Abnormal electrical activity. The SA node loses its role as the primary pacemaker. Instead, rapid and irregular electrical impulses arise from other areas of the atria, particularly around the pulmonary veins which carry blood from the lungs to the heart. These impulses can fire at rates of 300 to 600 times per minute, overwhelming the atria. 2. Ineffective atrial contraction. The atria cannot contract properly due to the chaotic electrical activity. Instead, they quiver, which reduces their ability to pump blood into the ventricles. This leads to a loss of about 15 to 30% of the heart's pumping efficiency. 3. Irregular ventricular response. The AV node, which normally regulates the electrical signals passing to the ventricles, is bombarded with too many impulses. It allows some of these impulses to pass through to the ventricles, but in an irregular and often rapid manner. This results in an irregular heartbeat, which can feel like a racing, fluttering, or pounding sensation. 4. Blood flow complications. Because the atria are not contracting effectively, blood can pool in the atria, particularly in a small pouch called the left atrial appendage. This stagnant blood is more likely to form clots, which can travel to the brain and cause a stroke or to other parts of the body, causing blockages. Types of AFib. AFib can be classified based on its duration and pattern. 1. Paroxysmal AFib, episodes that start suddenly and stop on their own within 7 days. 2. Persistent AFib, episodes that last longer than 7 days and require treatment to restore a normal rhythm. 3. Long-standing persistent AFib, continuous AFib that lasts for more than a year. 4. Permanent AFib, AFib that is accepted as ongoing and no further attempts are made to restore a normal rhythm. Risk factors and triggers. Several factors can increase the risk of developing AFib or trigger episodes. Age. The risk increases with age, particularly after 60. High blood pressure puts extra strain on the heart. Heart disease, including coronary artery disease, heart valve problems, and previous heart attacks. Other medical conditions, such as obesity, diabetes, sleep apnea, and hyperthyroidism. Lifestyle factors, excessive alcohol consumption, smoking, and high levels of stress. Genetics. A family history of AFib may increase susceptibility. Why is AFib dangerous? AFib is not just an irregular heartbeat. It can have serious consequences if left untreated. 1. Stroke. The risk of stroke is 5 times higher in people with AFib due to blood clots forming in the atria. 2. Heart failure. The heart's inefficient pumping can weaken the heart muscle over time. 3. Fatigue and reduced quality of life. Symptoms like palpitations, shortness of breath, and fatigue can significantly impact daily activities. In short, AFib is caused by chaotic electrical activity in the atria, leading to ineffective contractions, irregular ventricular responses, and an increased risk of complications like stroke and heart failure. Understanding this pathophysiology helps explain why treatments focus on restoring normal rhythm, controlling heart rate, and preventing blood clots. Symptoms. So what are the symptoms of AFib? Some people may not feel anything at all, but others might experience a racing or irregular heartbeat, shortness of breath, fatigue or weakness, dizziness or lightheadedness, chest pain or pressure. If you notice any of these symptoms, it's important to see a doctor right away. Let us go deeper into these symptoms. Atrial fibrillation can present with a wide range of symptoms, and in some cases, it may be asymptomatic, silent AFib. Diagnosing AFib involves a combination of clinical evaluation, patient history, and diagnostic tests. Symptoms of atrial fibrillation. The symptoms of AFib can vary depending on the severity of the condition, the individual's overall health, and whether the AFib is paroxysmal, intermittent, or persistent continuous. Some people may not experience any symptoms, while others may have noticeable and distressing signs. Common symptoms. Palpitations, a sensation of a racing, fluttering, or pounding heartbeat. This is often the most noticeable symptom and can be uncomfortable or alarming. Fatigue, feeling unusually tired or exhausted, even with minimal physical activity. This occurs because the heart is not pumping blood efficiently, reducing oxygen delivery to the body. Shortness of breath or dyspnea, difficulty breathing, especially during exertion or when lying flat. This happens because the heart's inefficient pumping can lead to fluid buildup in the lungs. Dizziness or lightheadedness, feeling faint or unsteady, which may occur due to reduced blood flow to the brain. In severe cases, this can lead to fainting or syncope, chest pain or discomfort. Some people experience chest pain, pressure, or tightness, which can mimic the symptoms of a heart attack. This is more common in individuals with underlying heart disease. Weakness, generalized weakness or a feeling of being unwell, often due to poor circulation. Reduced exercise tolerance, difficulty performing physical activities that were once manageable, as the heart cannot meet the increased demand for blood flow. Less common symptoms, confusion or difficulty concentrating. Reduced blood flow to the brain can affect cognitive function. Sweating, unexplained sweating, especially during episodes of rapid heartbeat. Frequent urination. Some people experience an increased urge to urinate during AFib episodes, possibly due to the release of a hormone called atrial natriuretic peptide, ANP. Silent AFib. In some cases, AFib may not cause any noticeable symptoms. This is known as silent AFib. Silent AFib is often detected incidentally during a routine medical checkup or when complications like stroke or heart failure occur. Diagnosis. Now, let's talk about diagnosis. If your doctor suspects AFib, they'll likely start with a physical exam and ask about your symptoms and medical history. They may also order tests like an electrocardiogram, ECG, or EKG to measure your heart's electrical activity. A Holter monitor or event monitor to track your heart rhythm over time. Blood test to check for underlying conditions like thyroid issues. An echocardiogram to get a detailed look at your heart's structure and function. Let's delve in detail about these diagnostic processes. Diagnosis of atrial fibrillation. Diagnosing AFib involves a combination of clinical evaluation, patient history, and diagnostic tests. The goal is to confirm the presence of AFib, assess its severity, and identify any underlying causes or risk factors. 1. Clinical evaluation and patient history. Symptom assessment. The doctor will ask about your symptoms, including their frequency, duration, and triggers. Medical history. A detailed history of any heart conditions, high blood pressure, diabetes, thyroid disorders, or other risk factors. Family history. A family history of AFib or other heart conditions may increase suspicion. Lifestyle factors. Questions about alcohol consumption, smoking, stress levels, and physical activity. 2. Physical examination. The doctor will listen to your heart with a stethoscope to check for an irregular heartbeat. They may also check for signs of heart failure, such as fluid retention in the legs or lungs. 3. Diagnostic tests. A. Electrocardiogram, ECG, or EKG, the gold standard for diagnosing AFib. An ECG records the electrical activity of the heart and can detect irregular rhythms. In AFib, the ECG will show absence of P waves, which represent normal atrial activity. Irregular RR intervals, indicating an irregular ventricular response. A rapid heart rate, if the ventricles are beating too fast. B. Holter monitor. A portable ECG device worn for 24 to 48 hours to record heart activity continuously. Useful for detecting intermittent, paroxysmal AFib that may not show up on a standard ECG. C. Event monitor. Similar to a Holter monitor, but worn for a longer period, weeks or months. The patient activates the monitor when they experience symptoms, allowing for correlation between symptoms and heart rhythm. D. Mobile cardiac telemetry. A wearable device that continuously monitors heart rhythm and transmits data to a healthcare provider in real time. Useful for detecting infrequent episodes of AFib. E. Echocardiogram. An ultrasound of the heart that provides detailed images of its structure and function. Helps identify underlying conditions like heart valve problems, cardiomyopathy, or blood clots in the atria. F. Blood tests. Used to check for underlying conditions that may contribute to AFib, such as thyroid dysfunction, hyperthyroidism, electrolyte imbalances, example low potassium or magnesium, signs of heart failure or inflammation. G. Stress test. Evaluates how the heart responds to physical exertion. May be used if AFib is suspected to be triggered by exercise. H. Electrophysiologist study, EPS. An invasive test where catheters are inserted into the heart to map its electrical activity. Used in complex cases to pinpoint the source of abnormal electrical signals. When to see a doctor. If you experience any of the following, seek medical attention immediately. Persistent palpitations or irregular heartbeat. Chest pain or pressure. Severe shortness of breath or dizziness. Fainting or near fainting episodes. In short, AFib symptoms can range from palpitations and fatigue to more severe signs like chest pain and shortness of breath. Diagnosis involves a thorough clinical evaluation, patient history, and diagnostic tests like ECG, Holter monitors, and echocardiograms. Early detection and treatment are crucial to prevent complications like stroke and heart failure. Management. Once diagnosed, how is AFib managed? Treatment depends on the severity of your condition and your overall health, but it generally focuses on three main goals. 1. Restoring a normal heart rhythm. This can be done with medications, electrical cardioversion, or procedures like catheter ablation. 2. Controlling your heart rate, using beta blockers or calcium channel blockers to keep your heart from beating too fast. 3. Reducing the risk of stroke. This often involves blood thinners to prevent blood clots from forming. Lifestyle changes also play a huge role in managing AFib. Eating a heart-healthy diet, exercising regularly, managing stress, and avoiding triggers like alcohol and caffeine can make a big difference. And if you smoke, quitting is one of the best things you can do for your heart. Now, we can understand more about the management. The management of atrial fibrillation, AFib, is multifaceted and aims to achieve three primary goals: restore and maintain a normal heart rhythm, rhythm control; control the heart rate, rate control; prevent complications, particularly stroke, anticoagulation. The choice of treatment depends on the type of AFib that is paroxysmal, persistent, or permanent, the severity of symptoms, the presence of underlying conditions, and the patient's overall health. We may now see the detailed management strategies for AFib. 1. Rhythm control. The goal of rhythm control is to restore and maintain a normal sinus rhythm. This can be achieved through medications, electrical cardioversion, or invasive procedures. A. Medications. Antiarrhythmic drugs class 1 antiarrhythmics. Examples: flecainide, propafenone. These drugs block sodium channels and are used to restore normal rhythm in patients without structural heart disease. Class 3 anarrhythmics. Examples: amiodarone, sotalol, dofetilide. These drugs block potassium channels and are effective in maintaining sinus rhythm, especially in patients with heart disease. Other medications: beta blockers, example metoprolol, or calcium channel blockers, example diltiazem, may be used to control heart rate during rhythm control attempts. B. Electrical cardioversion. A procedure where an electrical shock is delivered to the heart to reset its rhythm. Performed under sedation and is often used when medications fail to restore normal rhythm. Requires anticoagulation before and after the procedure to reduce the risk of stroke. C. Catheter ablation. A minimally invasive procedure where catheters are inserted into the heart to destroy, ablate, the areas of abnormal electrical activity, often around the pulmonary veins. Commonly used for patients with paroxysmal AFib who do not respond to medications. Success rates vary, and some patients may require repeat procedures. D. Surgical ablation, Mays procedure. A surgical option where small incisions or burns are made in the atria to create scar tissue that disrupts abnormal electrical pathways. Often performed during other heart surgeries, such as valve repair or bypass surgery. Now we'll talk about rate control. If rhythm control is not feasible or successful, the focus shifts to controlling the heart rate to reduce symptoms and prevent complications. A. Medications. Beta blockers. Examples: metoprolol, atenolol. Reduce heart rate and are often the first-line treatment. Calcium channel blockers. Examples: diltiazem, verapamil. Effective for rate control, but should be avoided in patients with heart failure. Digoxin. Used in patients with heart failure or those who cannot tolerate beta blockers or calcium channel blockers. Less effective during physical activity. B. Atrioventricular node ablation. A procedure where the AV node, the electrical gateway between the atria and ventricles, is destroyed using radiofrequency energy. A pacemaker is then implanted to regulate the heart rate. Reserved for patients who do not respond to medications or other treatments. Now, let us talk about stroke prevention. Stroke prevention, anticoagulation. AFib increases the risk of stroke due to blood clots forming in the atria. Anticoagulation therapy is essential to reduce this risk. A. Risk assessment. The CHADS-VAS score is used to assess stroke risk. Congestive heart failure, 1 point. Hypertension, 1 point. Age greater than or equal to 75 years, 2 points. Diabetes, 1 point. Stroke, TIA, or thromboembolism, 2 points. Vascular disease, 1 point. Age 65 to 74 years, 1 point. Sex category, female equals 1 point. A score of greater than or equal to 2 in men or greater than or equal to 3 in women indicates a need for anticoagulation. B. Anticoagulant medications. Warfarin, a traditional blood thinner that requires regular monitoring, INR testing, and dietary restrictions. Direct oral anticoagulants, DOACs. Examples: dabigatran, rivaroxaban, apixaban, edoxaban. Do not require regular monitoring and have fewer dietary restrictions. Preferred over warfarin in most cases due to their safety and efficacy. C. Left atrial appendage occlusion, LAAO. A procedure where a device is implanted to close off the left atrial appendage, the area where blood clots often form. Used in patients who cannot tolerate long-term anticoagulation. 4. Lifestyle modifications. Lifestyle changes play a crucial role in managing AFib and reducing the risk of complications. A. Diet. Follow a heart-healthy diet, such as the Mediterranean or DASH diet, rich in fruits, vegetables, whole grains, and lean proteins. Limit salt intake to manage blood pressure. Avoid excessive caffeine and alcohol, which can trigger AFib episodes. B. Exercise. Engage in regular, moderate exercise to improve cardiovascular health. Avoid overexertion, which can trigger AFib. C. Weight management. Maintain a healthy weight, as obesity is a significant risk factor for AFib. Weight loss can reduce the frequency and severity of AFib episodes. D. Stress management. Practice relaxation techniques like yoga, meditation, or deep breathing to reduce stress, which can trigger AFib. E. Smoking cessation. Quit smoking to reduce the risk of heart disease and improve overall cardiovascular health. 5. Monitoring and follow-up. Regular follow-up with a cardiologist is essential to monitor the effectiveness of treatment and adjust medications as needed. Patients with AFib should be educated about their condition, including recognizing symptoms and understanding the importance of adherence to medications and lifestyle changes. 6. Advanced and emerging therapies. Pulsed field ablation, a newer ablation technique that uses electrical fields to destroy abnormal tissue with less risk of damage to surrounding structures. Hybrid ablation combines catheter ablation with minimally invasive surgery for more complex cases. Gene therapy and stem cell therapy. Experimental approaches being studied for their potential to treat AFib by targeting the underlying causes. Let us conclude the management in a nutshell. The management of AFib involves a combination of rhythm control, rate control, stroke prevention, and lifestyle modifications. Treatment is tailored to the individual patient based on their symptoms, type of AFib, and overall health. With proper management, most patients with AFib can lead full and active lives while minimizing the risk of complications. Living with atrial fibrillation, AFib. Living with atrial fibrillation, AFib, can be challenging, but with the right strategies, support, and lifestyle adjustments, many people manage their condition effectively and maintain a good quality of life. Below is a detailed guide on how to live well with AFib, covering lifestyle modifications, symptom management, emotional well-being, and long-term care. 1. Understanding your condition. The first step in living with AFib is understanding what it is, how it affects your body, and what you can do to manage it. Educate yourself. Learn about AFib, its symptoms, triggers, and potential complications. Reliable sources include your healthcare provider, reputable medical websites, and patient support groups. Know your treatment plan. Understand your medications, procedures, and lifestyle recommendations. Ask your doctor to explain anything you're unsure about. Monitor your symptoms. Keep a journal to track your symptoms, triggers, and how you respond to treatment. This can help you and your doctor make informed decisions. 2. Lifestyle modifications. Making healthy lifestyle choices is one of the most effective ways to manage AFib and reduce the risk of complications. A heart-healthy diet. Focus on whole foods. Eat plenty of fruits, vegetables, whole grains, lean proteins like fish and poultry, and healthy fats like olive oil and nuts. Limit salt and processed foods. Excess salt can raise blood pressure, increasing the strain on your heart. Avoid triggers. Limit caffeine, alcohol, and spicy foods if they trigger your AFib episodes. Stay hydrated. Dehydration can worsen AFib, so drink plenty of water throughout the day. B. Regular exercise. Aim for moderate activity. Engage in activities like walking, swimming, or cycling for at least 30 minutes most days of the week. Avoid overexertion. Intense exercise can trigger AFib in some people, So listen to your body and avoid pushing yourself too hard. Consult your doctor. Before starting a new exercise program, discuss it with your healthcare provider to ensure it's safe for you. C. Weight management. Maintain a healthy weight. Obesity is a significant risk factor for AFib. Losing even a small amount of weight can reduce the frequency and severity of AFib episodes. Seek support. If you're struggling with weight loss, consider working with a dietitian or joining a weight management program. D. Stress management. Practice relaxation techniques. Try yoga, meditation, deep breathing exercises, or mindfulness to reduce stress, which can trigger AFib. Prioritize sleep. Aim for 7 to 9 hours of quality sleep each night. Poor sleep can worsen AFib symptoms. Stay connected. Spend time with loved ones and engage in activities that bring you joy. E. Avoid smoking and limit alcohol. Quit smoking. Smoking damages your heart and blood vessels, increasing the risk of AFib complications. Seek help from a smoking cessation program if needed. Limit alcohol. Excessive alcohol consumption is a common AFib trigger. Stick to moderate drinking, up to 1 drink per day for women and 2 for men, or avoid alcohol altogether. 3. Managing symptoms. Living with AFib often involves managing symptoms like palpitations, fatigue, and shortness of breath. Here's how to cope. A. Recognize triggers. Keep a symptom diary to identify patterns and triggers, such as stress, certain foods, or physical activity. Once you know your triggers, take steps to avoid or minimize them. B. Stay calm during episodes. If you experience an AFib episode, sit down, take slow, deep breaths, and try to relax. Use relaxation techniques like guided imagery or progressive muscle relaxation to calm your body and mind. C. Follow your treatment plan. Take your medications as prescribed and attend all follow-up appointments. If you have a pacemaker or other device, ensure it's functioning properly and report any issues to your doctor. 4. Emotional well-being. Living with a chronic condition like AFib can take a toll on your mental health. It's important to address your emotional well-being. A. Seek support. Talk to loved ones. Share your feelings with family and friends who can offer encouragement and understanding. Join a support group. Connecting with others who have AFib can provide valuable insights and emotional support. Look for local or online groups. B. Manage anxiety and depression. AFib can cause anxiety about your health or fear of having an episode. If you're struggling, consider talking to a therapist or counselor. Practice mindfulness or cognitive behavioral techniques to manage negative thoughts and emotions. C. Stay positive. Focus on what you can control, such as your diet, exercise, and stress management. Celebrate small victories, like sticking to your treatment plan or making healthy lifestyle changes. 5. Preventing complications. AFib increases the risk of stroke, heart failure, and other complications. Here's how to reduce your risk. A. Take anticoagulants as prescribed. If your doctor has prescribed blood thinners, take them exactly as directed to prevent blood clots and stroke. Be aware of the signs of bleeding, e.g., unusual bruising, blood in urine or stool, and report them to your doctor immediately. B. Monitor your heart health. Regularly check your blood pressure and heart rate at home if recommended by your doctor. Report any new or worsening symptoms, such as chest pain, severe shortness of breath, or fainting. C. Stay up to date on vaccinations. Infections like the flu or pneumonia can strain your heart. Stay current on vaccinations to protect your health. 6. Long-term care and follow-up. Living with AFib requires ongoing care and monitoring to ensure your treatment plan remains effective. A. Regular check UPS. See your cardiologist regularly to monitor your condition and adjust your treatment as needed. Discuss any concerns or changes in your symptoms during these visits. B. Stay informed about new treatments. Research is ongoing, and new treatments for AFib are continually being developed. Ask your doctor about emerging therapies that may benefit you. C. Plan for emergencies. Know the signs of a stroke, e.g., sudden weakness, slurred speech, facial drooping, and seek immediate medical attention if they occur. Keep a list of your medications, medical history, and emergency contacts in case of an emergency. 7. Traveling with AFib. With proper planning, you can travel safely and enjoyably with AFib. Pack your medications. Bring enough medication for your trip, plus extra in case of delays. Keep them in your carry-on bag. Stay hydrated. Drink plenty of water, especially during flights, to avoid dehydration. Take breaks. If traveling long distances, take breaks to stretch and move around to improve circulation. Know your destination. Research hospitals or clinics at your destination in case you need medical care. 8. Building a support system. Living with AFib is easier when you have a strong support system. Involve your family. Educate your loved ones about AFib so they can support you during episodes or emergencies. Work with your healthcare team. Build a good relationship with your cardiologist, primary care provider, and other specialists involved in your care. Connect with others. Join online forums or local support groups to share experiences and tips with others living with AFib. Finally, living with AFib requires a proactive approach to managing your health, but it doesn't have to limit your life. By making healthy lifestyle choices, following your treatment plan, and addressing your emotional well-being, you can reduce symptoms, prevent complications, and maintain a high quality of life. Remember, you're not alone. Reach out to your healthcare team and support network whenever you need help.